Hello, welcome back. Today we're going to talk about a very common and which can be very dangerous, catastrophic impact can have, and that is nothing but a stroke. So in earlier videos also we talked about lots about stroke and especially ischemic stroke. So as we discussed earlier, so there are two types of stroke. One is because of clot going into the brain and causing occlusion, causing obstruction to the blood supply to the brain. And another type that is because of bleeding in the brain, which we call because of rupture or hemorrhage in the brain. So in this video and then series of episodes which will be happening, we'll be discussing with you on stroke or paralysis because of bleeding in the brain, right? Because there is a major chunk which where stroke happens because of bleeding in the brain. And just to give you an idea, how severe is the thing, bleeding in brain, it consists around 20 to 30% of total stroke, and it is one of the major leading cause of sudden death and can give rise to long-term disability in the form of wheelchair bound or bed bound, and it really impacts across all age group. Not necessarily this sort of stroke happens only in old age. It's not like that. We've been seeing lots of patients very young in their in their adolescent group, in their 20s 30s. So from here you can understand the impact of the disease. So today in this introduction episode we'll be talking about what are the types of bleeding which can happen in the brain. So as you might be listening from here and there that bleeding has happened because of high blood pressure. So number one cause of bleeding in the brain, I would say, is because of high blood pressures, uncontrolled blood pressures, which can give rise to bleeding in brain. So somebody is having high BP and which is not being controlled with medicines or irregular medications, or because of some underlying cause, can give rise to bleeding because of high blood pressures. Number two cause. So number two is I would say aneurysm. So what is aneurysm? It's an ballooning of a normal artery. So there is a normal artery where because of weakness in the wall over few months to years, there is a development of aneurysm. There is development of ballooning, and this wall defect, this ballooning, this weakness in the wall suddenly can give rise to rupture, suddenly can rupture any time. So can be very catastrophic, giving rise to bleeding in the brain. And this type of bleeding in medical term we say it is subarachnoid hemorrhage. This is a bleeding which is slightly different from the bleeding which happens because of high blood pressure, because the site of bleeding is quite different. And just to give an idea, so subarachnoid hemorrhage bleeding, so we having a layer of water which is covering over our surface of our brain. So there is a layer of water which is flowing, and also it is having connections with a cavity inside the brains, which in medical term we say it is ventricle. So the ventricle and the subarachnoid space is connected. So there is a continuous circulation of water-like substance, which in medical term we say cerebrospinal fluid. So there is a fluid which is flowing across inside the brain also and outside the brain. So actually our brain is floating inside our cranium. So when there is a bleeding happens because of this ballooning, because of this aneurysm, so bleeding happens inside this sort of subarachnoid space, and there is a spread of blood all over, right? So this is second most common cause of bleeding in the brain, and this sort of bleeding can be very catastrophic, like 40-50% patient in spite of the best treatment may not survive at all, and 1/3 of patients they just they don't reach hospital in time, they just die, they just demise in that way. Very horrible. So this is regarding subarachnoid hemorrhage. There are other types of hemorrhage, like number three we'd like to say is because of some abnormal blood vessel connections, tuft of blood vessel connections in the brain, that is called AVM or arteriovenous malformations, or maybe AVF, arteriovenous fistula. So where there is, because of abnormal connections, there is high flow happens, and there is suddenly rupture of this stuff of blood vessels, maybe because of weakness in the wall, or maybe there is some ballooning of formations, and over the time that ruptures. So this type of AVM bleed can give rise to bleeding in the brain parenchyma, and this type of bleeding can be catastrophic also, and the patient can even present with a seizure-like, fit-like episodes also, or headache something. Other than this AVM or arteriovenous fistula, so number 4 I would like to put because of maybe some trauma causing or recurrent fall can give rise to bleeding in the surface of brain. Usually we say it is SDH, subdural hemorrhage, or maybe EDH also, epidural hemorrhage, or even this can happen because of some drugs, especially blood thinners, which suppose some person is taking, and in that scenario the bleeding can happen either spontaneously or because of fall, or minor injury or minor head injury can give rise to this sort of bleeding over the surface of the brain in the form of like a subdural hemorrhage. Other than this, we have seen bleeding because of thinning of blood. So thinning of blood can happen because of either some liver disease per se, or somebody is on anticoagulation, somebody, as I said already, on blood thinners can give rise to thinning of blood, and this thinning of blood can give rise to bleeding in the brain itself. And one of the interesting thing we can find out that if you do a CT scan, you can make out the possible cause, like whether this is because of likely cause of it's because of high blood pressure, or it's because of aneurysm rupture, or it's because of tuft of abnormal vessels, as I said, AVM, or it's because of trauma, or it's a subdural hemorrhage. So you can make out that one, and you can treatment can be offered based on that. For a layman, for a person, most important thing is that how to identify that one. That is very, very important, very, very, very crucial. What are the signs, what are the symptoms, so that we can identify if somebody is having bleeding in the brain, or somebody is having abnormal tufts in the brain. So what are the symptoms? So that's very crucial. And then next is the treatment. What is the treatment available? Can the patient be cured, completely cured, and how much benefit can have and with the treatment. So in our upcoming episodes, we'll be discussing about symptoms. We will be discussing about how to prevent about bleeding in the brain, like because of hypertension and other things. And most importantly, supposedly somebody is having this sort of problem, what is the best treatment available, what is the treatment we can offer to have a complete recovery. Thank you.